Good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. Thank you for joining us for today's vaccination update. This is format as a news conference, and I'll just explain a little bit about how that works in a minute. First, I want to introduce, we've got Assistant County Manager Joe Connor with us. We also have Elizabeth Holshoe, who is the Director of Epidemiology for Johnson County Department of Health and Environment. And we've got Brett, our ASL interpreter. Thank you for being here. So for members of the media who are with us in the Zoom, what you can do is if you have a question, go ahead and put it in the Q&A. We'll have some information presented from Joe and Elizabeth. And when that's done, I'll go ahead and open up questions for the media. I'll go ahead and choose a member of the media. You can go ahead and we'll unmute your audio and you can say your question. And so with that, I will turn it over to Joe Connor.
Well, good afternoon, everyone. Joe, as Jody said, my name is Joe Connor, Assistant County Manager. Part of my responsibilities in my job is over the Department of Health and Environment. And so again, here today with Elizabeth Holshoe to go through a number of points that we want to try to highlight from what's happened this week to what's going to happen next week, and then some improvements that we made into our communication system to better communicate with you. So first I'm going to start with Ms. Holshoe and let her go through some things that have happened this week and some more information we want to share. So Elizabeth, thank you.
Thanks, Joe. Yeah, so we're going to start and talk about the total number of vaccinations that we believe have been administered for COVID-19 since the beginning of our vaccine rollout, which was started at the end of December. We have started working, or we've been working with the Kansas Department of Health and Environment to be able to obtain this information. We know how many vaccines the Department of Health and Environment has administered, but as you know, we have a number of partners who are vaccinating members of our community, and so trying to obtain a better picture of what that looks like. So to start with, Johnson County Department of Health and Environment has vaccinated over 20,000 individuals, or have administered over 20,000 doses, I'm sorry. And if we look at the community as a whole, Johnson County as a whole, it looks like there's about 32,000 people as of a couple of weeks ago who have received at least their first dose, and another 9,500 who have received their second dose, so are completely protected through vaccination for COVID-19. Now, these data do lag because of some data entry timing. And so we're continuing to work with the Kansas Department of Health and Environment, who are working with the federal government to ensure that these data are as accurate as possible. And we will continue to be able to report this out on a weekly basis. And we're excited for that progress. In terms of this week, Johnson County Department of Health and Environment administered 3,360 vaccines, and those were across a number of our different categories within that phase 2 tier 1. We immunized this week most of our first responders in Johnson County, so those are going to be our fire, our police, and our sheriff's office, and we're hoping to really complete the majority of those individuals on Monday, although of course anybody who is unable to receive it this week or Monday, we will continue to work in as we move forward. We also were able to administer 2,500 second doses to our healthcare workers, and this is an incredibly important group because oftentimes they are treating patients who have COVID and are at an increased risk. We have also been able to work in some of our 80 plus population. And of course, as you've heard, and we'll talk about a little more, we've been working with our healthcare partners to also be vaccinating that 65 and up population. This week as well, right now, we are starting our first K through 12 vaccination clinic. It started about 2 o'clock today. And so that is ongoing, and we have clinics today and tomorrow. And again, that's going to be this week for our public school staff. And we are working those immunizations through the administration of those school districts. And next week, we'll move into our private parochial schools, the School for the Deaf, and our childcare. Mr. Connor?
Thank you, Elizabeth. So let's talk about next week. Currently, I don't believe we know what vaccines we're going to be receiving for first doses next week yet. We expect it to be less than we got this week for a variety of reasons, but we don't know that for sure. The one thing that we do know and are planning for is the number of people that need their second dose. That'll be a fairly high number for next week. So our clinics will be dealing with those that need their second dose, as well as looking at the 80 and over category of those that have completed our interest survey. We continue to have a good response to our survey. We continue to try to make sure that people do not fall through the cracks. We keep culling that data on a regular basis, and we will be contacting you once we have vaccine available and we have slots in our clinic available to do that. Our vaccine clinics next week will be on Tuesday, Wednesday, and Thursday from 9 a.m. to 1 p.m. And again, that'll be for those that need their second doses and the 80+ group that's in our interest survey system. We'll talk a little bit also about the healthcare system partnerships. We've continued to have really positive meetings with the leadership and the communications folks from those different groups. All of the facilities in Johnson County have expressed an interest in partnering with us on that. And they're starting to contact people and starting to schedule their own events. And then as we continue to provide the vaccine, they will continue to do that for us. One issue that we've talked about extensively yesterday was on the issue of equity and fairness. And I know there's been a lot of concerns and about, if I'm not part of the hospital system, am I going to be left out, and how's it going to be distributed, and those kind of things. And so I think there's a lot of willingness on the part of the hospitals to be sensitive to that. We're continuing to figure out the best way to try to measure that and make changes to ensure that we don't leave pockets of people out or don't leave geographic parts of the county out. And so we'll be continuing to work on that particular issue with our healthcare partners. And remember that we will continue to have clinics on a regular basis also. So if you don't feel like you're a part of a healthcare system, you don't feel like you have any connections there, you always have a connection to us. And again, the vaccine interest survey will be that connection point with us. We are remaining fairly consistent with guidance that we receive from the federal and state government. We still believe that it's a good model to have additional providers that help us with distributing the vaccine. And while the supply continues to be low now, and it doesn't seem, we think our minimum capacity is way more than what we're receiving every week with our hospital partners. We're planning for the future. So we're planning to be able to say, when we receive, tens of thousands of doses each week, we'll have a system in place that will be able to be distributed quickly and effectively. Again, I don't want to harp on the issue of supply. We all know it. County of 600,000 people receiving 6,000 doses a week. That's hard math. So we hope that continues to improve. I'm going to ask Ms. Holschuh to talk about our work with our independent living facilities. So Elizabeth.
Thanks. Absolutely. So we have a number of long-term care facilities and independent living facilities in our county. Some of these independent living facilities are associated with things like assisted living or memory care, and those facilities have been included in this federal pharmacy partnership program. However, if it's a freestanding independent living facility, so sort of a senior housing type living facility, those have not been included in the federal pharmacy program. And so when we've identified that these individuals who are clearly at high risk for complications from coronavirus were really being missed in our rollout of vaccine, we've been working very hard and very diligently to ensure that they are captured and that they are going to be immunized. Through this work in partnership with our commissioners and our long-term care facility liaison, we have identified 24 independent living facilities, which accounts for about 1,600 residents. So we're continuing to work with them and our partners to really solidify plans to ensure that we can get vaccine to them. And that may look like a mobile clinic to these individual facilities. And those plans are being solidified. And as soon as we have those, we will continue to share that information out.
Great. Thank you for that, Elizabeth. The last section I wanted to talk about was kind of on our communications and as well as our improvements that we've made to our technology systems to hopefully better communicate with you. We have a lot of room for improvement, and I think that we will continue to look for improvement as we go down this path every week. We are going to continue the Facebook Live events for the public and the media. We think that this is a pretty effective tool to get direct feedback, from you on it. We've also taken our website and tried to put it into subpages to make it easier to navigate. Over time, we've noticed that as the information around COVID-19 and the coronavirus in general has come in, it's getting hard to find things. And so we divide it up into subpages to make it easier for you to search and hopefully easier for you to find what you need and stay connected with us. One thing that we've heard a lot from, or for a lot from individual people that just not sure if they've successfully completed the interest survey. They didn't get any confirmation emails. They didn't get any feedback from us. And so one of the things that we've piloted today, and we will be doing it from this day forward, is a notification system that automatically generates, whether that be an email, a cell phone call, or text message, or a phone call itself, to let you know that you've completed your interest survey, we have your information, and we're able to contact you. So when the appointment slots come up, we will be able to get you an appointment, let you know how to schedule an appointment. If you've already received a vaccine today and are curious, why did I get that message? Please disregard. I mean, I think that's part of our message. We just wanted to make sure that our system is contacting everybody that's in there to let them know we know who you are, we know how to contact you. Going forward, as new surveys are entered into the system, we will be identifying and notifying only those new surveys that come in. So this was kind of our way to level set the communications playing field with the interest survey. And again, if you have questions, please call us, but that was our strategy. And moving forward, it should just be for those new surveys that are received. The other thing that we did internally is we have stood up a joint information center, and we have staff throughout the organization that are monitoring social media and monitoring email traffic, basically 12 hours a day, 7 days a week for the current time. We also have an expanded call center. We've got about 15 people that are in our call center now, with our goal to answer as many phone calls in person that we can. We also have an additional system in place with more staff. I want to say it's in the 5 to 7 range, that if you do leave a voicemail, and we encourage you to do so if you don't, we don't get the phone picked up, that those are being routed to other people to review and respond. So again, our goal is to quickly communicate with you and give you the information that you need, or at least let you know at a minimum that we've gotten your message and we will be getting back to you. So we've made those enhancements, and hopefully you'll see the difference. We're continuing to measure that on a daily basis. And then administratively, from the executive level, we're meeting twice a day now to monitor the different situations that we're having. So we're taking a look at what's happening in the short term with the call centers, vaccination clinics, things along those matters. But we're also trying to look ahead and plan for the future when we do have, and solidify our plans for the future when we do have additional vaccines available, and make sure that what our capacity is and how we can make decisions more quickly when those things do happen. So moving forward, I would say we're trying to adjust to what we've heard. We're trying to adjust to the changing circumstances, and we will continue to do that. And we, as always, we'd like your feedback, and we'd like to be able to hear from you. So, we've got a few ways to do that, and hopefully you'll continue to communicate with us. So I think with that, I think that's our presentation for today. So Jody, I don't know if there's any questions or.
Yep, we do. It looks like Kylie McLaughlin with the Shawnee Mission Post has a question. So if we can unmute Kylie, we'll let her answer or let her ask the question.
Hi, so I saw that earlier this week, the CDC announced that the federal retail pharmacy program for COVID-19 vaccinations would begin on Monday next week. What does that exactly mean for vaccination availability in Johnson County? Does that mean on Monday, like a 75-year-old resident could go get a vaccine at CVS, or is it a little bit more complicated than that?
Go ahead, Elizabeth, why don't you take that one first?
Yeah, I'll take that. Thanks for the question, Kaylee. Unfortunately, as much as we would all hope that would be the answer, that is not. It would be great if with a snap of a finger, we were able to get vaccine from the federal government to our pharmacy partners and start immunizing as many residents as possible in this phase. Unfortunately, supplies are still limited. It's unfortunate the line we have to keep using. The most recent information from KDHE is that there may be about 10,000 doses for the entire state of Kansas coming for this partnership. So if you really calculate that out and what that means per population, it's not a huge influx of doses for us. And so while there may be some availability, unfortunately, because of the supply issues from both Pfizer and Moderna's manufacturing side, I don't think it's going to be the quick fix that we all hoped it would be. But we'll continue to monitor. I think any additional doses that we can get into our community is excellent. And so we're thrilled that the partnership is moving forward. But it's really very dependent on how quickly both Moderna and Pfizer are able to sort of push out those vaccines from their manufacturing warehouses and get them out to us.
Yeah, and I think to follow up with Elizabeth's point, this is going to be another entry point for our residents to receive the vaccine. So we'll have, our department, the hospital systems, and now individual pharmacies. Once supply increases, those partnerships will be in place, and we have, again, multiple access points for people to receive the vaccine.
Haley, did you have any other questions?
Did not. Thank you for answering my question.
Sure. Since we have a little bit of time, I might take a few that we're seeing on Facebook real quick. One question we're seeing is really an update on the plans for educators. Why aren't teachers being vaccinated right now? What is the plan for teachers?
Absolutely. So I'll take that one. So teachers are being vaccinated, actually. So we started with our special education teachers and paras and aides. And again, this is because of the high risk for exposures and quarantines for both the teachers and the students in those classrooms, because the students oftentimes in these classes are unable to mask or mask well. And so if somebody is positive in that class, we generally have to quarantine a large number of individuals. And so it's a huge effect on these classrooms. And so we started with our SPED, our special education providers, but we have been able to open up those some additional doses to teachers this week. And so each of the public school districts have been asked to sort of prioritize their staff based on a variety of options, and really that is up to the school district themselves. Some have opted to prioritize based on critical infrastructure. So these jobs that they can't live without, they can't function, they can't operate their school buildings without. So bus drivers, custodians potentially. Other school districts have opted to do that based on age and on pre-existing conditions. And so we have started to get some of these teachers in this week. Next week, we will begin with private and parochial school teachers. And then we will also be beginning our daycare providers, both from homes and from centers. And so we are starting that and hope to continue to take some of our allotment each week from the state of Kansas and sort of push it into that group. Again, this phase 2, tier 1 is very large, including our first responders. But the great thing is we've sort of chipped away with them and we're sort of moving. We've gotten almost all of them done. So that allows us to use our limited capacity, our limited doses for our 80 plus for our schools and our childcare providers. So we will continue to do that in the coming weeks, again, in partnership with Children's Mercy, who's taking the lead on these populations.
Thank you. And Elizabeth, I heard you talk about prioritization and how it's really up to the schools to use their best judgment to prioritize the way they'd like to. So we had another question similar, but it has to do with hospitals. What they're asking is, why are we allowing hospitals to limit vaccine to their own patients? So I'm interested in with healthcare systems, does the county have any oversight, or how are healthcare systems prioritizing the doses that they receive?
Right. So I'll start with this one. I think that one thing to remember, when the vaccines were first being distributed across the country, hospitals were instructed they were going to get their own shipment, and it was for their staff and for their patients. And so that's what they were doing up until there was a decision to change and make the county health departments the central hub for the entire community. So the hospitals are remaining true to their to what they had signed up for when they were asked by the federal government for what their role was going to be. That we feel that they're going to provide an opportunity for a lot of Johnson County residents as well as those that work here. And so again, that's as that has changed, their mission stays the same. They're very good community partners. They're very interested in getting to as many people as possible, and including just some members of the general public that aren't their patients. And so that's an evolving situation with how they're going to handle it. But they have capacity, they've got a willingness, and we think they're going to be a great partner.
And I'll just follow up with a little bit more. The hospitals, while they are immunized, some of them are immunizing their own patients, some are immunizing the public, but they are still staying within that phase 2 tier 1. We've had a lot of conversations that they are going to focus on the 65 and up. They may not be doing 80 and up the way the Johnson County Department of Health and Environment is, but they are staying true to that phase 2 tier 1 so that we're all on the same page here in Johnson County to ensure that we are immunizing those in that first phase or that first tier completely before we move on. So that is a common thread among all of our health systems and the Department of Health and Environment.
Thank you. And I'd like to talk about second doses because we continue to get a lot of questions. Even right now, people are saying, you know, my dose is due today, my dose is due tomorrow. When am I going to hear from you? So what is the plan for people who are waiting for their second dose? And it's that date is coming up quickly in their minds.
Yeah.
Absolutely. So I'll take this. We'll be sending out emails tomorrow morning for people who are due for their second doses. But again, a reminder that that second dose does not have to be on that exact 21 or 28 days from that first dose. You have 42 days or 6 weeks from the first dose to receive that second. So if your second dose was due today or tomorrow, don't worry, the vaccine is still effective if we get it to you next week. And so stay tuned, check your email. And if you're doing a dose and have not received an email or notification from us by about midday tomorrow, you can go ahead and give our hotline a call and we can work to get you signed up for a spot. But we do have second doses for you and we will get you in and get you that dose.
Yeah,
And do you have that hotline number that you mentioned, Elizabeth?
Sure. Somebody may have to help me with that.
I believe it's 913-715.
CV19.
Okay.
The one thing I did want us to follow up with that, I mean, the second doses, the shipment of those are coming in at a regular cadence and we're getting what we need for the second dose. So there's not a supply issue, at least not yet. I hope there never is one for the second dose. So the numbers that we're talking about receiving each week are just first dose only to introduce new people into the vaccination process. Second doses come separately in separate shipments, and those are being received on time and in appropriate numbers.
Thanks, Joe. And that hotline number is 913-715-2819. One more question. When will people who maybe have are compromised or have health issues, when will they be able to get the vaccine?
So per the KDHE's vaccination plan, individuals age 16 to 64 with pre-existing health conditions, depending on which condition it is, land in either phase 3 or phase 4. And those various health conditions are broken out based on the risk of severe complications from coronavirus. And so really following the data to prioritize individuals. Unfortunately, when that comes is very dependent on, again, vaccine supply and really getting through that first phase 1 and finishing up phase 2. And again, phase 2 is a very large group with our 65 and up population, of which there's over 90,000. We also have our educators in there, which is over 20,000 residents. And so, you know, as Mr. Connor said, when we're only getting 6,000 or 7,000 doses a week, it does take us a while to sort of chip through that group. But each week we're making progress and we're moving forward. And as soon as we're getting those doses in, we are getting them into the arm so we can move through phase 2 as quickly as possible and get to those additional phases.
Okay. And why don't we take one more question and then we will wrap this up for today. So somebody has a spouse who lives in Johnson County, but is a patient through a Missouri hospital. Should they get the vaccine through that Missouri hospital, even though they're a Johnson County resident? What would be your advice for that person?
My advice would be get the dose when you can, where you can. So Johnson County is immunizing individuals who live or work in Johnson County. But, you know, I've talked about this before. If you're a teacher, for instance, who lives in Johnson County, but maybe works in another jurisdiction, at this time, you're not eligible through us, but certainly reach out to that county or that state where you work and see if you're eligible there. Vaccine supplies are limited everywhere, but certain jurisdictions have different requirements. And so if you can get the dose, certainly go ahead and do it.
And one more question, when you have finished phase 1, or let's say you get to the point where you have finished this tier of phase 2, if somebody didn't get their vaccination during that time frame, they still can. Correct.
Absolutely. We are still immunizing healthcare workers who maybe weren't able to get it in that first round. We have some teachers who were slotted to go in this week, but are now in quarantine, so they can't get it. yet because they're in quarantine, so they can't come in. So absolutely, if we missed you in that phase, in the phase you belonged in, for whatever reason it may be, let us know. We will work to get you in, and we will keep getting individuals in from previous phases and tiers.
Yeah, and that goes to our looking at our survey data on a regular basis and seeing who's new, what category do they fall in, and then prioritizing those folks moving forward. Even if we move past that phase, we're going to continue to look for those folks and identify them.
Great. Joe, Elizabeth, anything to add before we wrap up?
I don't have anything more to add. I appreciate the opportunity to be here and to help explain things. And again, we want to continue to communicate, with everybody, and we want to continue to do better at it. And just know that when we receive vaccine in, it is gone the next week. So, and we will continue to provide that level of service moving forward.
That's a great point. Thanks so much, Joe, Connor, Elizabeth Holschuh. Thanks so much for joining us today. Thanks for members of the media who are either watching on Facebook or through Zoom, and to the public who is watching on Facebook and asking great questions. We will continue to do these to keep you educated on Johnson County's vaccination rollout plan. So thanks so much, everybody. Have a great rest of your day.
Thank you.
Thanks.